And sitting in for Dr. Joel Wallach today, we've got Dr. Peter Glidden. Welcome back to the show, Dr. Glidden.
Thanks a lot, Doug. Happy Thursday, everybody. March 27th, 2014. Tonight, my colleague, mentor, and friend, and your own Dr. Joel Wallach at the Fantasyland Hotel in Edmonton, Alberta, giving his famous Dead Doctors Don't Lie lecture. That's 7:30 p.m. tonight in Edmonton, Alberta. Tomorrow night, the beat goes on. Sherwood Park, Alberta, at the Strathcona County Community Center in Sherwood Park, Alberta. Both of those events start at 7:30 p.m., followed by a Saturday in Camrose at the Camrose Regional Exhibition Center. Dr. Wallach up in the Great White North. He's going to be up in Canada until through April 6th, I believe, April 4th, 5th, or 6th. After he finishes up in Alberta, he heads east towards Ontario and Toronto. And what other 74-year-old man do you know gives 300 free lectures a year? Do you know anybody? Right offhand, does anything spring to your mind? Dr. Oz? Does Dr. Oz give free lectures? Heck no. Is Dr. Oz in his 70s? Heck no. Dr. Wallach is the man. Dr. Wallach lives on American Airlines. Dr. Wallach has committed his entire life towards eliminating human suffering by building a slow and steady 17-year overnight success story with longevity by generating a grassroots coalition of the informed, people all around the world who are sick and tired of feeling sick and tired, who know that there must be a different way, who know that there must be a science-based, clinically verified alternative to drugs and surgery. There simply has to be. Because like Dr. Phil says, how those drugs and surgical procedures working for you now? How are those medical insurance premium payments paying off for you? Was that a good investment? Well, according to statistics, numbers don't lie. It's a horrible bet. Death by Medicine by Gary Nell, Ph.D., Carolyn Dean, M.D., N.D., Martin Feldman, M.D., Deborah Racio, M.D., and Dorothy Smith, Ph.D. So I quote, "Something is wrong when regulatory agencies pretend that vitamins are dangerous, yet ignore published statistics showing that government-sanctioned medicine is the real hazard." A group of researchers meticulously reviewed the statistical evidence, and their findings are absolutely shocking. These researchers have authored a paper titled Death by Medicine that presents compelling evidence that today's system frequently causes more harm than good. The fully referenced report shows the number of people having in-hospital adverse reactions to prescribed drugs, 2.2 million per year. The number of unnecessary antibiotics, 20 million per year. The number of unnecessary medical and surgical procedures, 7.5 million per year. The number of people exposed to unnecessary hospitalization, 8.9 million people per year. The most stunning statistic, however, is that the total number of deaths caused by conventional medicine is an astounding 783,936 per year. It is now evident that the American medical system is the leading cause of death and injury in the U.S. By contrast, the number of deaths attributable to heart disease was 700,000, and the number of deaths attributable to cancer was 550,000. The number of deaths caused by MDs, 783,936. This is like the decline of the Roman Empire, right? When an industry is monopolized completely, totally, and utterly, as the medical industry has been all around the world, this is not just a United States phenomenon. Corruption is soon to follow. Your medical doctor, your MD, may be the nicest person in the world, but they only know what they've been trained in. And what they've been trained in is one tiny piece of the pie of medical science. And quite frankly, it's an old-fashioned, outdated, archaic, incorrect, absurd, juvenile way to look at health and healing and the relationship between the human body and pathophysiology. Don't believe me? Well, believe numbers. I'm telling you, the way that the MD is trained is outdated, old-fashioned, and dangerous. It's inconsistent with what it really means to be a human being. It is inconsistent with the truth of the matter. And guess what? When you deliver old-fashioned, ineffective, out of step with reality treatments, your treatments become the leading cause of death in the United States. And not only are MD therapeutics the leading cause of death, but they're also the leading cause of suffering, because while we have given ourselves over to the MD completely, while we have genuflected at the altar of MD-directed allopathic reductionistic pharmaceutical medicine for the last 100 years, Alzheimer's has risen from obscurity to become the sixth leading cause of death. Autism has risen from 1 in 10,000 to 1 in 50. High blood pressure on the rise, pun intended. Heart disease on the rise. Arthritis on the rise. Cancer. After $600 billion of research money, we are no closer to a cancer cure than we were when Richard Nixon, issued his vendetta war on cancer back in the 60s. Ladies and gentlemen, the United States medical system, the allopathic pharmaceutical centrist medical systems around the world do not need to be upregulated. They do not need to be downregulated. They do not need to be tweaked or modified. They need to be abandoned, because for chronic disease, they simply do not work. I'm Dr. Peter Glidden. Stick around. Thanks a lot, Doug. It's always a pleasure to be here, especially today, because Dr. Wallach is up in Canada with Team Glidden, up in Canada with the Longevity's Team Glidden. 3 consecutive lectures, and then I think we're going to do 2 more after that. So it's a marathon, but that's Dr. Wallach, man. He is like the Energizer Bunny. I'm so happy to be here. What do you think about that monologue, Doug?
I liked it because it goes hand in hand with what I was going to talk about today, which is a CNN story that is headlined, 1 in 25 patients gets an infection in the hospital. And this was published in the New England Journal of Medicine. They say patients acquired some 721,800 infections at hospitals in 2011. And of those infected, 75,000 died, and that's according to the CDC. They say pneumonia and surgical site infections were the most common types of infection, accounting for 22% of all infections, followed by gastrointestinal infections such as Clostridium difficile, or C. diff, urinary tract infections, and infections of the bloodstream. Study also shows that they're making progress, though. In 2002, they estimated 1.7 million healthcare-associated infections and 155,000 plus infected patient deaths. In 98,987 of those deaths, the patient's infection was actually caused or contributed to the death. And according to Dr. Michael Bell, director of the CDC's Division of Healthcare Quality Promotion, he says, for example, blood infections from central lines dropped 44% from 2008 to 2012, but there's still some things we haven't figured out how best to manage yet. C. diff infections, for example, have become more severe in the past decade, and more bacteria are resistant to antibiotics and account for at least 23,000 deaths each year, according to the CDC. Hospital infection rates are very significantly, that is, between states and even between neighboring hospitals. The study included 183 hospitals and 11,282 patients surveyed between May and September of 2011. So there you go. That's no wonder they're the leading cause of death, because they're giving people infections.
Well, it speaks to a lot of things here, right? Number one, can you imagine what would happen if one naturopathic physician or one chiropractor or one acupuncturist or one herbalist gave one patient an herb and it killed him? There'd be a public outrage. It would be all over CNN. The professions would need to be severely regulated and punished. And, we may even lose licensing practices. But when the MDs do it, they get a pass. When the MDs kill people, they get a pass. And, nobody's perfect. I mean, it's one thing to, have an accidental slip up, or something happens and, that's just life and you did your best and whatever. But most of these infectious diseases that are being transmitted in hospitals are completely preventable through a more thorough sterile technique practice in the hospital, which is why the statistics for secondary infections here from hospitals vary so greatly from hospital to hospital and state to state. It isn't like the C. difficile bacteria really likes to live in Massachusetts and it hates it in Florida. It's not like that. It's because different hospitals have different administrative staffs and they have different levels of intensity of their sterile technique guidelines. For goodness sake, all the MDs need to do is just be more consistent with washing their hands, for goodness sake. It's incompetence before the fact, but nobody holds their feet to the fire. The New England Journal of Medicine will publish an article, and, oh, isn't this alarming? Oh, isn't this upsetting? But nothing happens. Nobody goes to jail. There are no consequences except, of course, people die. And then their relatives mourn. And then more people die. And then their relatives mourn. And then everybody, when they pass the hospital, genuflects for a moment of silence. It's nonsense. We all have Stockholm Syndrome. I'm convinced. Stockholm Syndrome is when the kidnapped people, the kidnappees, develop feelings of affection for the kidnappers. Well, we've all developed feelings of affection for the MD when, in fact, they're killing us. They're infecting us. Their incompetence is hurting us. But what do? We write another medical insurance premium check so it'll give us access to the leading cause of death in the United States. Ladies and gentlemen, it's like that movie, The Matrix, the medical matrix, right? It's all a giant dream. It's all a giant illusion, and you are in the middle of it. Well, consider me the red pill. Let's snap out of the matrix together and get our health back. Thanks a lot, Doug. By the way, folks, if you're new to my name, especially if you're of the Benny Hinn fan club and you've come to this radio show through the Benny Hinn interview, check my website out, check my radio show out. I've become the second witness for Dr. Wallach, and happily so. I'm a licensed naturopathic physician. I have over 25 years of clinical experience, and as God is my witness, Dr. Wallach has forgotten more about the pathophysiology of medicine than most physicians know. My advice, based upon 25 years of clinical experience and 5 years of mentoring exclusively with Dr. Wallach, if Dr. Wallach says jump, you say how high. So happy to be here. Check my website out. That's drglidden.com. That's Glidden like the paint, no relation. Or fireyourmdnow.com. That's fireyourmdnow.com. Doug, let's go right to the phone.
So let's head to Texas. And Linda, you're on with Dr. Peter Glidden.
Hello, Dr. Glidden. I was born with a heart defect and had open heart surgery approximately 7 years ago. About 3 years ago, I continued to have this dull heart ache pain in my chest. About 3 years ago, the doctors ran me through all the EKGs, stress tests, MRIs, trying to see if what was going on. They found nothing and told me said that I was just more in tune with my body than maybe the average person, so I could feel everything that was happening to my heart. Like if I laid on my side, I would get some pain on it and so forth. I'm experiencing more chest pains these days and a little bit stronger. And I was wondering, is there anything that I could take that will help my heart, make it strong, maybe help prevent these chest spasms that I'm having?
Well, yeah, absolutely, positively, and you've come to exactly the right place, and that's why we do what we do. But we can't overlook the 5,000-pound gorilla in the middle of the room. Right, so you have strong and persistent symptoms for years. You've taken those strong and persistent symptoms that you've had for years to the only doctor that your medical insurance gives you access to and to the only physician that your state licenses and regulates. You've paid tens of thousands of dollars over the course of your life in medical insurance premiums to give you access to conventional medicine when you need it, and you need it. So you have strong and persistent symptoms. You take your body to the only medical show in town, the MD. They do thousands of dollars of diagnostic tests and come up empty-handed. Rather than blaming themselves, rather than blaming their lack of diagnostic insight, rather than looking to their own camp and trying to make things better, learning from their inadequacies, they blame you. Oh, it's not the doctor's fault. It can't be the diagnostician's fault. It can't be the juvenile nature of the diagnostic procedure or the pathophysiological understanding. It has to be your fault. You have an overt sensitivity to your heart. You've got to be kidding me. This is nonsense. Quite frankly, whomever it was that told you that, I would write a letter to the Surgeon General of my state or whoever it is that's in charge of the dispersion of medicine in your state and say, look, these people are nuts. I want an investigation because I have strong and persistent symptoms. I paid them thousands of dollars and they gave me nothing. I'm going to give you something when we come back. Stick around. Thanks a lot, Doug. We're talking to Linda from Texas, who's got a problem with her heart for a long time. Linda, are you still with me?
Yes, sir.
Okay, so what we do here, Linda, is what every doctor in the world should do in relationship to chronic disease. We don't treat heart disease specifically. In a private practice, I treat heart disease. In a state that licenses and regulates naturopathic medicine, in which I have secured a naturopathic medical license, I can say that I treat disease. I can hold myself out to the community as a physician and say, look, I treat disease. But in the context of longevity, in the context of this radio show and the radio show that I do, we don't treat disease. What we do, however, is recommend therapeutics which are science-based and clinically verified, which were developed and delivered by physicians, licensed and regulated physicians, the intention of which are to support and promote your body's built-in God-given ability to fix itself. And this is the fundamental difference between our methodology and the MD methodology. And as God is my witness, Linda, if everybody in the world understood what I'm about to tell you, everything would be different. Your medical doctor, bless his or her heart, may be the nicest person in the world, but they don't know what's best for you. They only know what they've been trained in. And what they've been trained in is a type of medicine called allopathic reductionism, which argues the human body does not have the ability to fix itself. There is no soul, there is no spiritual force, there is no inherent God-given intelligence inside the body. You are just an evolutionary accident, a biochemical bag of biochemicals, a bag of biochemicals which is destined to go wrong. And when something does go wrong, it's not the MD's job to fix you. It's the MD's job to manage you, to give you medications which don't fix the problem, but which suppress your symptoms. So, I'm not surprised that the MD came up blank here. It happens all of the time, and why we continue to write a medical insurance premium check every month in the face of their startling incompetence boggles my mind. So our recommendation is a good recommendation. It's a holistic boilerplate foundation medical nutrition recommendation. It's easy breezy lemon squeezy. What we advise people to do is take certain nutrients into the body in doses appropriate for your body weight, the intention of which are to support and promote, in your case, your cardiovascular system. So in order to accomplish that, the recommendation would be how much do you weigh, by the way, Linda?
160.
160. Okay, so for 3 months, here's what I would do as a little in-house experiment. I would do one healthy brain and heart pack. One healthy brain and heart pack. One healthy brain and heart pack. That's the original formula. I would do the original formula of the healthy brain and heart pack. I would do one extra bottle of Beyond Osteo FX, one bottle of Beyond Osteo FX, 2 bottles of Ultimate Selenium, 2 bottles of Ultimate Selenium, and 2 bottles of Z Radical. That's Z like zebra radical. That's 2 Z Radical, 2 Selenium, 1 Beyond Osteo FX, and 1 Healthy Brain and Heart Pack. Get those supplements. Now, one more thing you have to do. There are 10 foods that we've identified as harmful and hazardous to human health, and everybody needs to stop eating them. 10 foods. You can get that list for free on my website, fireyourmdnow.com. Just scroll down the page until you see the little link for my free list of the 10 bad foods. Download that list. It's free. Get the nutritional supplements from the person who directed you here. Take them every day for 3 months. Give us a call back on about week 4 with a report. We're here to make you better. I appreciate your trust and your phone call. Now go get your health back. Hey, Doug, is that the phone I hear ringing?
It sure is. Let's stay right there in Texas and head over to Jürgen. You're on with Dr. Peter Glidden.
Hey, Jürgen. Thanks for the phone call. What's up?
Good afternoon. It's a 3-month follow-up I'm calling you about for my colleague.
Great.
She has been on a 2 starter pack 2.0 per month, 2 Balance FX per month, and went on a gluten-free diet for 3 months now.
Yeah.
Treat psoriasis and shorten her 2-week periods. She has been checked for lactose and gluten intolerance, which I guess came back negative. And she thinks she's gotten worse for the psoriasis, and the periods are still 2 weeks long.
Okay. All right. How long has she been doing it?
3 months now. And before that, it was a year of some other program that I got out of Let's Play Doctor.
Yeah, okay. So, all right. So, how much does she weigh, do you know?
200 pounds.
Okay. So, the only time that medical nutrition doesn't work is if you're not taking the right stuff. You know, you're taking the healthy brain and heart pack and you have a bone and joint problem, right? Or you're taking the healthy blood and sugar pack and you've got a digestive problem, whatever. You're not taking it appropriate for your body weight, or you're not absorbing it, right? Now, the naturopathic physicians always said, and this underlines the fundamental difference between the holistic approach and the MD approach, right? The MD approach is quick fix, but it's not really a fix. It's just kind of a washover, right? It's like painting over the mold in the basement. Well, you paint over the mold, that's going to take like 30 minutes, and then you're not going to smell or see the mold anymore, but it's still there. So, you know, you take a prescription medication and 20 minutes later, 30 minutes later, the headache's gone, whatever. Healing with medical nutrition is a long-term supposition. It's a process, not an event. And, you know, we expect to be in this for the long haul. The old-timers always said that it takes approximately 1 month for every year that you've had the problem to get on the other side of the problem. So if she's had psoriasis for 20 years, she should expect 20 months, more or less, to get on the other side of it. Now, does that mean that it's going to be 20 months of nothing, and then all of a sudden on the 19th month and the 29th day, she, you know, on the 20th month, she's going to wake up and everything's going to be miraculously gone? No. It's a slow and steady slide into health. And so what we need to pay attention to here in people that present with chronic, persistent, hardcore symptomology is, once they start the program, how does it make them feel in other areas of their life, right? Because this is holistic medical nutrition. This is not a psoriasis treatment. This is not a menstrual cycle regulation treatment. This is medical nutrition, the intention of which is to optimize the structure and function of the whole person. So, when we get on board with a program like this, I encourage people to pay attention to mood, energy, appetite, sleep, sex drive, you know, the little tiny stuff, the stuff that we've just gotten used to being bad in our lives. So, I mean, have you had any conversation with her about any of this stuff? Has anything improved at all in her world in the last 90 days?
It was all good questions. Really don't know the correct answers to them.
Yeah, this is why it's hard to do this third party, right? Yeah.
She used, that's the problem. She got off her thyroid medicine that regulated it. It basically kept the thyroid dormant, and she is off that. And since she's been on all these Wallach longevity products, you know.
Yeah.
She blames he regulated now.
Yeah, it's tricky. Yeah, well, it depends on how long they've been unregulated. And so the recommendation, what I would like to see her do, there's a couple things that she can tweak in this regard, okay? So psoriasis, of course, is a skin condition, so she would benefit from more skin support. And from our point of view, psoriasis is caused by chronic inflammation to the skin. And what causes chronic inflammation to the skin? The consistent consumption of food that's high in free radicals. So she doesn't just need to be on a gluten-free diet, she needs to eliminate all 10 of the bad foods, which include oil in a bottle and fried food, well-done red meat, etc., etc. And if you don't have that list already, by the way, this is the list that Dr. Wallach recommends, the 10 bad foods. You can download it free at my website, fireyourmdnow.com. Just scroll down the page until you see it. It's a list of 10 bad foods. You need to stop eating those. She needs to stop eating those. I need to stop eating those. Not just gluten, but there's 6 other foods she needs to stay away from. Number 2, she would benefit from increasing her consumption of food and beverages and nutritional supplements that are high in antioxidants. Because we believe that it's oxidative damage that's causing the psoriasis. So taking antioxidants is a smart idea, as well as stopping the consumption of food that's high in free radicals, which cause oxidative damage. So the recommendation here for something like this, her target should be 100,000 ORAC points of antioxidants a day. 100,000 ORAC points of antioxidants a day. Now, you've been with Youngevity for a while, so you know what that means. You can dial that in with the Triple Treat chocolate, with the Z Radical, with Cell Shield RTQ, with green tea, switching from bananas to blueberries, switching from, salt and pepper to curry powder and cayenne, whatever. You want to keep taking salt, of course. 100,000 ORAC should be her goal, plus complete elimination of the 10 bad foods. I would have her double down on the calcium dose that she's taking right now. Double down on the calcium dose. For 4 weeks, have her take twice as much calcium every day as she's taking now. If she's taking 2 ounces a day now, have her take 4 ounces a day. If she's having 2 ounces a day now, have her take 4 ounces a day. And last but not least, have her start leaning towards foods which are high in cholesterol. Because all of her sex hormones, all of your sex hormones, all of my sex hormones are made from cholesterol. That's what they're made from. So when we have a hormonal problem, it would be prudent to feed the body the stuff that it makes hormones from. Well, your body just can't make a hormone out of thin air. It needs raw materials. Well, she's getting some of those raw materials in the 90 for Life stuff, but she needs cholesterol as well. The body can only make about 20% of the total cholesterol that it needs. She needs to eat food that's high in cholesterol, man. Chicken, eggs, butter, full-fat milk, full-fat dairy. Guaranteed, because of her weight issue, the knucklehead MDs who have no training, no experience, no respect, and no appreciation for medical nutrition have told her to be on a fat-free diet, guaranteed. And that's probably the precipitating factor that led to the hormonal menstrual cycle irregularity. If she doesn't have enough cholesterol in her body can't make the hormones that it needs to have a healthy, normal, optimized cycle. So the easiest way to get cholesterol in the body is the chicken egg. If she's allergic to eggs, chicken eggs, then she should get a duck egg or a quail egg or a goose egg, right? Butter, full-fat milk, full-fat dairy, 100,000 ORAC of antioxidants a day. And another thing that she can do, which I recommend to everybody, by the way, I don't care what the condition is, I don't care what we're trying to support and promote, everybody gets selenium, especially if we're trying to increase the body's antioxidant activity. Selenium is a major player. My recommendation for selenium here is Dr. Wallach's recommendation, 1 bottle per 50 pounds per month, not to exceed more than 4 bottles per month. So have her tweak it like that. Have her just stick in there, look to see the little eeny weeny teeny daily stuff and see whether or not that's improving, and have her hang her hat on that. Because healing from this stuff is a process, not an event. Hope that helped, Texas. I appreciate the phone call and the trust and your support for longevity. Keep up the good work in Texas.
We're back on Dead Doctors Don't Lie with our guest host today, Dr. Peter Glidden. Welcome back.
Thanks a lot, Doug. Let's get right to it. Who's
All
next?
right, let's head to Oklahoma. And Cleo, you're on with Dr. Peter Glidden.
What's going on, Cleo?
Much.
Yeah,
Yes.
how can I? Yeah, go ahead.
My husband is 85. He weighs 116 pounds, and we found out he had cancer in the upper lobe and into his shoulder about 5 months ago. He's been to the VA and took 16 treatments of radiation, and he's waiting now to be checked to take more. And I need to know how to help him. I've got your tangerine deal, and your Beyond Osteoflex, and your Cell RTQ, and your EFA Plus, and I have picked up some selenium that's just 200 micrograms, and some shark cartilage.
Okay, good. Well, here's what. There's a couple things we need to understand here. We can't treat cancer. It's illegal. The only people that can treat cancer in the United States are the people that are horrible at treating it, the oncologists. And if you're not unbelievably incensed about that situation, you should be. Because the MDs have completely let us down with cancer. They're the only ones that can treat it, and the treatments that they deliver are ineffective, dangerous, expensive, and quite frankly, they cause cancer. So, in order to support and promote the structure and function of the body, in this gentleman's case, in addition to what he's already doing, I would get as much Z-Radical as you can afford, as much Z-Radical as you can afford. That's made by a longevity subsidiary called Escape. It's there in the longevity back office. If he can afford 1 bottle of Z-Radical a day, that's what I would do. If he can afford 1 bottle of Z-Radical every other day, once a week, once a month, that's what I would do. Plus eliminate the 10 bad foods. Plus eliminate the 10 bad foods. I wish I had better advice for you, but I don't. The only people that can treat cancer in the United States are the people who are horrible at it, and that's a crying shame. Time for one more, Doug.
Let's head to Portland, Oregon. And Yelena, you're on with Dr. Peter Glidden.
Hi, Doctor. Let's see how many I can ask you. I have questions, but let's see if I can do 2. I have a friend who's scheduled for surgery for tomorrow. She has a polyp, and when she went in August 2013, the doctors didn't know what it was. They said, oh, it might be a polyp, but it's benign, it's not that bad. And then she admitted to an ER in October in 2013 with extreme pain and blood loss. And they said, oh, this is a polyp. They confirmed that it is a polyp. And then she has, for 5 to 6 months, she's had bleeding and spotting. And so she went in for an MRI or ultrasound, just a few weeks ago, and they said, oh, it's a golf-sized polyp, and you should remove it now. And before they said, oh, let's see what will happen to it, see if it grows or something. And now it's like a golf size, and they're saying, oh, you have to remove it because that's the only thing you can do.
So why? So why isn't she calling us?
She doesn't believe in anything else. She believes doctors, and I'm begging her. I'm like, don't.
Well, then there's nothing. No, there's nothing I can do. There's nothing we can do. I mean, I can tell you what I would do if I were her, but she's not going to do it. So, we're wasting our time with this. You need to leave the dead to bury the dead. If people aren't going to believe it, then you don't need to waste your time with them. It's a free country. They can do whatever they want. She's bet on this particular horse, and she's going to lose, and that's a crying shame. We've got time for one more question. What do you think?
Well, I really need your opinion for this. Is it true that the doctor said that she needs to take a surgery? Is this true?
Well, no, I don't. I'd have to look at the report. I'd have to look at, I can't tell you that over the radio. But what I can tell you is when all you have is a hammer, everything looks like a nail. The only thing that the MD is trained in is drugs and surgery. That's all that they have experience with. So from their point of view, yes, surgery is the only thing possible. But from my point of view, surgery for non-life-threatening conditions should be the last thing we entertain, not the first thing that we entertain, the last thing. I would go with the Healthy Digestion Pack, selenium appropriate for body weight, 3 bottles of Mackie Plus a month, 3 bottles of Mackie Plus a month, plus eliminate the 10 bad foods. Dead doctor.